Today we're going to discuss some clinical cases that are challenging when dealing with the dental dam. So the first thing we're going to cover is dealing with cervical restorations. So to begin with, let's first discuss the two types of clamps that many people get confused when they are using dental dam. So first we'll discuss selecting the appropriate clamp for your retraction of your class 5. Many people get the two style clamps confused, the 9 versus the retractor style clamp, whether it be a Brinker retractor style clamp or a 212. Now the difference is, of course, the number 9 is used for root canal therapy only. It's not intended to be used as a cervical retracting clamp. First of all, it doesn't do a very good at retracting anyway, and secondly, the retractor clamp has been designed so that it gives you the perfect retraction for a class 5. Here we go. We have a class 5 on tooth number 8. And as you can see, you have really very good gingival retraction. Now, the reason why you need to isolate additional teeth when you're doing your cervical restorations is because the gingival retractor clamps are not very stable. And as you see how it can rock. Now, you can stabilize this clamp with green stick compound. The compound would be heated till it slumps, and with a wet gloved hand you would roll a little cylinder and you would lay the compound over the bow and the two adjacent teeth on either side. So you would do this for both sides of the clamp. That would stabilize the clamp. And so ideally, you would get your clamp stabilized, prepare your restoration, and then you would proceed with restoring it. Let me just show you, we're going to talk a little bit about the retractor clamps. And what I wanted to show you is that not only can you use the retractor clamp for your anterior isolation, you can use it for your posterior. As part of the Brinker retractor system, Dr. Hunter Brinker developed these clamps. These will retain the dental dam as well as provide your retraction for your class 5, whether it be on the lingual or the buccal. And they don't need to be compounded for stability. So here I have our patient, and here is a Brinker retractor clamp in position on the lower arch here. And as you can see, this clamp will provide you access to your class 5 on the buccal lesion. And so that's what's recommended if you have a posterior class 5. Any of these 3 clamps. Ideally, the B1 is for the lower arch, the B2 and 3 is for the upper arch. However, I have used the B2 and 3 on the lower arch as well. It depends. I find that the 2 and 3 give me a little bit more retraction, so if you have more of a subgingival lesion, then the 2 and 3 would do a better job of retracting. So now once you have your class 5 prepared, I'd like to introduce you to a system called Blueview Cervical Matrices System. I find this to be a benefit because it expedites the placement and finishing of your restoration. And let me show you how the system works. So first of all, you have various sizes to accommodate the cervical areas of various teeth. And you have a placement instrument. One end of the instrument, the one that's straight on, is for your anterior placement of your matrices system. And the other end has a bit of an angle. So you would place your matrix system, such as this, and then you could come in this way for more of a posterior view. But today we're going to isolate and we're restoring tooth number 8. So when you're placing your system, you want to place it at the cervical area first and then push down towards the apical area. What this does is it expels any excess material, and the curvature of the matrice will automatically form the restoration for you. You don't have to worry about dealing with placing with a composite instrument. And then you can cure with this in place. And once it's cured, you have a minimal amount of finishing. You can expedite your placement much more readily with the use of this system.